welcome to the urinalysis and pregnancy testing competency video. Today we will walk through testing the urinalysis with a manual dipstick. We will walk through the pregnancy testing competencies. And we need to gather our supplies. We have a urine sample. We have our pregnancy test kit, which is a cassette in there. And then we have our manual urine dipstick bottle. And then I have a watch because this is a time test and it's important that we follow the time frames on these. So I will start with by performing hand hygiene. It's important when you're going into the patient room to verify two forms of patient identification, which can be the name and date of birth or the patient's last four numbers of their Social Security. And that is per Wheeler Clinic policy. I will then apply personal protective equipment, which consists of gloves in this scenario. When performing a urinalysis, it's important for you to grab your culture prior to introducing any foreign bodies into your sterile sample of urine. So you would perform this test before, even if you're not sure if the patient is going to require urinalysis, so that you have a clean, sterile sample in the event you do need it. And that is accomplished by using the vacutainer kit and just inserting the vacutainer into the urine cup and pulling and inserting the tube onto the vacutainer and obtaining the urine. That can be labeled and set aside and does not need to be preserved in the refrigerator. So we will begin by opening the urine, and then we will take one of the urine strips out of here, and initially we're going to verify the expiration date, which is 12/2017. And this bottle has also been noted with the date that it's opened. I'm not sure if you can see that, but it says 1/3/17. So we'll take one strip out, being careful not to touch any of the pads on the strip, because that will contaminate the strip. But you can see there are several colors on here, and those will correspond with the graph of colors on the urine tube. So I'm going to insert this into the urine and be sure that the urine touches all the pads. And then I'll just blot the excess urine off on the side. Close the urine. I'm just going to put that aside for our purposes. And again, I have my watch. So the first test is read at 30 seconds. And then, so I'll go through what this is testing for. It's testing for glucose, bilirubin, ketones, specific gravity, blood, pH, proteins, uroglobin, nitrates, and leukocytes. So it's been 30 seconds, so I'm going to start reading this. And you're going to just take this stick and compare it to the colors and move it along the graph until you find the color that matches what's on the little pad. So the first is glucose, and it matches the green coloring, which is negative for glucose. The next one is bilirubin, which is also 30 seconds, and again, that's negative. The next one is ketones for 40 seconds, and we've reached that. So again, there are no ketones in this urine. The next one is specific gravity, which is at 45 seconds, and the specific gravity on this particular sample is 1.030. And then next few are all read at 60 seconds, and that will be blood. And this sample is negative for blood. The pH is measured at 6.0. Protein, looks like maybe a trace of protein. It's a very slight different color green. And then the next one is uroglobin, which appears to be negative. And then nitrates, which is maybe trace nitrates in this particular sample. And then the last test is for leukocytes, and that is 120 seconds. And we're just about there, and that's also negative. And I'll just bring this a little bit closer so you can see the different colors and how they match up. It's important to read this at exactly the time frames it's indicated on the bottle, because the coloring will change and get darker. And then if you read that in 2 minutes, all of them, you'll have erroneous results. So this can get discarded into the regular waste. And then you want to take an alcohol swab and clean the side of the bottle, because as you can see, I had the urine soaked strip on here, and we want to make sure that whoever goes to grab the bottle next is not contaminated if they aren't wearing gloves quite yet. Okay. Now we'll proceed with the pregnancy test. And again, this, as with everything else, this pregnancy test has an expiration date on it, and it is January 2018, so it's good to use. And in this little container is the urine cassette for the pregnancy test, and then a little dropper. So we will again open the urine, and this cassette is going to take three drops of urine in the test section area, and then I'll show you at the end, but it's going to have a color which will go across the whole test result area to indicate that the test is valid, along with the line for the control test. So we're going to squeeze the pipette or the dropper just to get a little bit of urine up into it, and then we'll drop 3 drops into the testing area. Okay, it's important that this cassette remains flat during the testing period, so I can't pick it up and show you the coloring, but I will at the end. And so you can set the timer for this for 2 or 3 minutes on your watch, or however you want to do it, whether there's a clock in the lab, and then come back for the test in a couple of minutes. When you're finished with these results, all of the urinalysis test results as well as the pregnancy test results will be recorded in the lab book, quality control, and patient results logs, and then also in the patient's electronic health record. When you're talking with the patient and obtaining the patient's samples for testing urinalysis in pregnancy, it's important for you to tell them exactly how to obtain that urine sample. So let's go through that right now while we wait for the pregnancy test results. When you're asking a female patient to obtain a clean catch urine sample, you want to provide them with 2 to 3 standing wipes, a sterile urine cup that has not been opened, and you want to place the patient's name label sticker on the cup so you know whose urine is whose. And then you'll instruct the patient to open 1 standing wipe at a time, and then you'll instruct the patient to wipe front to back on the left side, and then front to back on the right side, and then front to back from down the middle. And they can discard each standing wipe in the toilet when they're finished with that. They should begin to urinate and then catch the sample midstream. It's important that they do not touch the rim of the cup to their skin when they're trying to collect the sample for you. And they can secure the cup and then provide it to you, or leave it in the window in the bathroom. For a male, he may take 1 standing wipe and clean the tip of the penis in a circular motion, and that is sufficient. And again, start the flow and then catch the sample in midstream. Careful not to touch the cup to any part of the skin. Okay, it looks like we have a result, so I can pick this up and show you. There is a slight color that you can see. It's a pink color, and that goes across the whole testing area. And then we have the letter C, which is the control, and there's a line next to the letter C. This indicates that the test is valid. Every test must have a line next to the control area. If it does not, the test is not valid. The next section is the letter T, and if there's no line there, that indicates the patient is not pregnant. And if there is a line, then the patient is pregnant. Again, presence of a line at the control level or the C level indicates the test is valid. And on the logbook, in the particular log for the pregnancy testing, you will see a section that you need to mark whether the test was valid with the presence of a control line. So this test was positive for a control line, so this was a valid test, and the patient is not pregnant. If there was no C line, then this would not be a valid test. If the color did not fill the whole testing area, test result area, this would not be a valid test. If you saw a line at the level of the T, but no control line, patient cannot be verified as pregnant. You'd have to repeat the test because there was no control line. Okay, so this can get discarded again in the regular waste. It is not biohazard. There's not sufficient quantity to warrant biohazard disposal. You will remove your gloves, perform hand hygiene, and then sanitize your testing area. And that concludes the urinalysis and pregnancy testing competency video.